Madam Chair, council members, and participants, we are now live.
Thank you very much. Good afternoon, everyone. This is the joint hearing of the Special Committee on Gun Violence Prevention and Children and Youth regarding resolution number 200524. I understand that state law currently requires that the following announcement be made at the beginning of every remote public hearing. Due to the current public health emergency, City Council committees are currently meeting remotely. We are using Microsoft Teams to make these remote hearings possible. Instructions for how the public may view and offer public testimony at public hearings of council committees are included in the public hearing notices that are published in the Daily News, the Philadelphia Inquirer, and Legal Intelligencer prior to the hearings and can also be found on phlcouncil.com. Will the clerk please call the roll to take attendance? Members that are in attendance will please indicate that they are present when their names are called. Also, please say a few brief words when responding so that your image will be displayed on screen when you speak.
Councilmember Derek Green.
Good morning, Madam Chair. Looking forward towards engaging conversation for today's hearing.
Good afternoon.
Councilmember Isaiah Thomas.
Good afternoon, Madam Chair. Good afternoon, colleagues. I'm present.
Good afternoon.
Councilmember Jamie Gaudier.
Good afternoon, Madam Chair. Good afternoon, colleagues, and to the public present.
Good afternoon.
Maria Quinones Sanchez.
Good afternoon, colleagues. I am present. Thank you.
Thank you.
And that is it for roll, Madam Chair.
Thank you very much. A quorum of the committee is present and this hearing is now called to order. Will the clerk please read the title of the resolution?
Resolution number 200524, authorizing the committees on gun violence prevention in children and youth to conduct joint hearings to examine the need for universal access to trauma counseling for Philadelphia's youth.
Thank you so much. So as individuals know, our council chair will be joining us, Councilmember Johnson will be joining us shortly. And this is a continuation of the conversation from last week's hearing. And given that the mayor's budget address landed this morning, this is also a really important time for us to continue the conversation around the city's prioritization of addressing public safety, dealing with gun violence, and in particular, dealing with the trauma and the counseling supports that are necessary to help young people deal with what the past year has brought to them. Last week, we heard from leadership of the school district and city agencies. We heard from doctors and principals and from the leaders of community organizations that are working to support young people experiencing trauma. We also know that there are about 25 schools, charter, alternative, and public schools that are deeply impacted by gun violence in particular. The amount of gun violence impacting youth in our city is staggering. Not only about the tragedy that happened last night in Councilmember Gautier's district, but there have been over 750 school-aged children who are shooting victims in the city of Philadelphia since January 1st of 2020. It is unacceptable, it is horrifying, and is deeply, deeply harmful to our city. The impact of gun violence on our youth is not evenly distributed across our school system. Over 50% of those young shooting victims were enrolled in just 25 schools in the city. We know that we have to do more to support those young people. We know that those school staff at those particular schools need additional help and support and services. And when we are doing things such as conflict resolution, such as expanding counseling supports, such as helping young people connect to jobs, other types of supports in schools, we can better handle, the situation that our city is facing right now. We've also heard from doctors and school principals about how trauma starts so early for many children and how important it is that we consider the needs of elementary schools that feed into our high schools where the impacts of violence are concentrated. School principals told us how even though the district has a high-level plan and process for how to respond to gun violence, many of those resources and processes are not always felt on the ground in the ways that they are intended. We have spent time as a committee engaging directly with young people over the past several weeks in multiple roundtables and in other events. They have repeatedly told us how rare and impactful it can be to develop a trusting and meaningful relationship with an adult mentor. They shared how many youth are suffering from extreme depression and other mental health issues, and how critical it is to have robust access to counselors and mental health services available in their schools. And how, in addition to trauma counseling services, youth shared with us that they do need access to jobs and meaningful programs that continue into the evening to make sure that there's a safe space, that there are activities, and that there's a sense of community wherever they may be. I look forward to hearing from panelists today about the need for trauma counseling for youth in the wake of violence, and I'm committed to securing our young people the resources they need and deserve. And I know I speak on behalf of all of our colleagues and members of our respective committees. With that, I'd like to offer any of my other colleagues an opportunity for any opening remarks if you are available for it. Great. Seeing none, we're going to begin to hear testimony from the witnesses we have today. Everyone who has been invited to the meeting to testify should be aware that this public hearing is being recorded. And because the hearing is public, participants and viewers have no reasonable expectation of privacy. By continuing to be in the meeting, you're consenting to being recorded. I also want to recognize the presence of Councilmember Mark Squilla. Thank you so much. Good afternoon, Councilmember Squilla.
Good afternoon. Thank you both chairs, and appreciate this hearing today.
Additionally, prior to recognizing members for questions or comments that they may have for witnesses, I will note for the record at this time that we will be using the chat feature available in Microsoft Teams to allow members to signify that they wish to be recognized. In order to comply with the Sunshine Act, we ask that the chat feature only be used for this purpose and only be used by council members. And with that, again, I want to express my gratitude for today's panelists, many of whom were prepared to speak last week and generously made themselves available again today. Will the clerk please call the first panel?
Darcy Walker-Krause and Samantha Petrowski.
Good afternoon, everybody.
Good afternoon.
Thank you so much. If you could just say your name for the record, and you may proceed with your testimony.
Thank you. My name is Darcy Walker-Krause, and I'm the Executive Director of Uplift Center for Grieving Children. I want to start by thanking Council Members Johnson and Gim for inviting me here today to provide this testimony. And thank you as well to the co-sponsors of Resolution 200524 and to all the Council members here today for your hearing on this critically important issue for Philadelphia's children, youth, and families. I want to start by providing some introductory information on the work that Uplift Center for Grieving Children provides. And then as requested, I will move into the effects of gun violence that we are seeing firsthand, as well as gaps in services and needs for youth in Philadelphia. Uplift Center for Grieving Children helps children grieving a death to heal and grow through their grief while strengthening families, communities, and professionals' understanding of how best to respond to their needs. Our vision is simple and direct. No child should have to grieve alone. To effectuate this mission and vision, Uplift provides free grief groups to children who have lost a significant person in their life. These groups provide support and coping skills for grieving youth and are provided in several formats. In the family services format, both the child and caregiver attend concurrent peer grief groups facilitated by clinicians. Families can attend as long as they need. We also offer shorter-term grief groups in schools and community organizations. These groups run between 6 to 8 weeks. All grief groups are run by master's level trained clinicians and are curriculum based. Our curricula include a homicide specific loss, Spanish language, ambiguous loss, and LGBTQIA+ curricula. In addition to grief groups, Uplift works closely with the network of neighbors and its partners in responding to crises around the city, and Uplift's clinicians provide legacy groups, which are memorial groups for youth who have lost friends or teachers, most often to homicide. Finally, Uplift provides training to professionals throughout the city of Philadelphia. To date this year, and just to give you scope, We've run 66 family grief groups for children, youth, and caregivers, and we will be providing another 16 by June with additional summer grief programming planned. In schools, we have provided grief groups to 55 schools and with another 43 schools receiving support this spring. And I want to note that this number is actually reduced from prior years. The prior year, we actually ran 200 school grief groups. It's just with the virtual learning that we've seen a decrease in school groups, but actually an increase in our family grief groups. We provided post-crisis support and legacy groups to nearly 500 youth. And the surge in gun violence and death has been extremely dramatic. Each week I see 3 to 4 emails about different schools seeking support to deaths of students. Finally, we've trained more than 2,200 professionals since September in grief and trauma. When schools closed in March of 2020, we partnered with Dr. Jamie Banks and the School District of Philadelphia to create the Philly Hope Line, a helpline that provides support for children, caregivers, and families who are experiencing mental health issues such as stress, anxiety, and isolation, losses such as death loss or ambiguous loss, and other crises. Uplift has utilized the Hope Line to provide critical support to youth and families in Philadelphia. And we've also been able to use that in coordination with the school district's Office of Prevention and Intervention, as well as the network of neighbors, in coordinating post-crisis response and offering a warm line where affected youth and families can call to receive support. Finally, Uplift has been involved in CHOP's Growing Resilience in Teens, or GRIT project, which was presented at last week's hearing. Uplift's clinicians are providing additional grief groups and ambiguous loss groups for CHOP's Care About Center and in partnership with the Netter Center in schools in West Philadelphia. This work has offered the clinical staff at Uplift a front row seat to the crises that are facing our city, including gun violence, homicide, COVID-19, the fall of the pandemic, and racial trauma. These crises did not individually rise overnight. They've been building for years, and now they have combined together with the pandemic to put Philadelphia's youth, families, and city at large in a state of crisis. Youth coming to Uplift do not come to talk to group and speak of grief in a vacuum. Instead, they find Uplift because of the grief they may have experienced when their dad died by homicide or their mother succumbed to COVID. But they soon begin to speak of these other crises and how they are impacting their young lives. They talk about the effect of Walter Wallace Jr.'s death and their fears. They speak about the violence in their neighborhoods, even if the person they are grieving did not die by violence. These crises and the trauma youth are facing cannot be separated out. All of this work has given the clinical team, myself, and Uplift's clinical director, Kevin Carter, time to reflect on the gaps and issues that we see when it comes to serving children and youth in Philadelphia. Here's what tops our list. Trauma should be dealt with first, but grief is what often presents. How youth and families access services matters. And as a clinician and social worker, I know that when working with an individual who's experiencing both trauma and grief, whether they're related or not, the trauma should be treated first. But what we're finding at Uplift is that we often don't have that luxury. Families are overwhelmed with grief, and if turned away for some individual trauma support, they might never get any support. They also are most acutely aware of what they're experiencing right now: loss, often to violence or COVID. Trauma services need to incorporate grief support as they are inextricably intertwined in Philadelphia. 2, the city is full of strong community organizations like Uplift, but there's often a lack of awareness of the services among practitioners. We've been open for 21 years and operating at the current capacity that I shared earlier for almost 8 years. And still every day, we find practitioners and people who do not know of Uplift or what we do. And this is true for other community organizations in the city as well. There's an under-awareness of what exists. 3, city agencies put into place for violence prevention or similar functions often are not working directly with community-based organizations for input on program design or services, which can result in underfunding of pre-existing programs and duplication of services already in existence. 4, while recent efforts such as Network of Neighbors have provided coordination and collaboration in post-crisis response among service providers, greater collaboration and coordination is still needed. Community organizations operate with extremely limited resources, and better coordination and collaboration will allow for these resources to be used most effectively. 5, we need to give youth and families a voice in the service design and development. Reducing trauma for youth includes giving youth a larger voice, more autonomy, and self-efficacy in the response to the crises they are facing. I was pleased to hear Councilmember Gim's remarks last week about the Youth Roundtable. We believe that is a critical first step in engaging youth in the response to these crises. 6th, funding. I know that you all are probably waiting for that word from an executive director of a nonprofit. But it's true. Each and every community organization I know working in this sector could use more funding for more clinicians to provide more services, to give them the ability to get their services around the community they serve or across the city, and to be able to provide longer term grief and trauma support beyond the immediate response or a short term solution. What we are facing didn't arise overnight, and the response is not a short term one. We're looking at more than a decade of work to support youth who are reeling from the crises that started before us and still rage on. In closing, as an organization focused primarily on grief support and education, Uplift Center for Grieving Children strongly supports this resolution and the need for trauma counseling for youth in the city of Philadelphia. We know that proper clinical support can stem additional violence and the physical and mental health risks associated with the adverse childhood experiences that Philadelphia's children and youth are facing on a daily basis. Should such counseling be funded, we urge that the considerations and gaps we raised be considered, including youth leadership and design, relying on pre-existing community organizations to provide services, and encouraging collaboration and coordination of efforts to best use organizational resources. Thank you again for your time and for giving Uplift Center for Grieving Children and the children and families we serve a voice here today.
Thank you so much. To our next testifier, are you connected and ready to speak? And if you are, if you could just state your name for the record.
Samantha Petrosky. Good afternoon, Madam Chair, Mr. Chair, and council members. My name is Samantha Petrosky. I'm a clinical director. I represent the Camelot Education, a provider of several programs of the Opportunity Network in the Philadelphia School District, Alternative Education. I would like to take the time to thank everyone here for being a staple in this movement for change. Thank you for holding this space and giving an opportunity for our voices to be heard. I want each of us today to think about how we're informed of traumatic events and what this looks like in our school community. I invite you to take time to imagine the possibilities. As your mind wanders, let me guide you through some of my experiences. It is being in a group therapy session and exploring what it looks like to stay safe over the weekend, and knowing that this may be the last time that you hear your student's voice. It is ending your group session when one of your students is crying while sharing out that they wish for each of us to hug our loved ones, to say I love you, and to make amends with the broken relationships that you may have in life because this student just had a family member shot and killed. It is a school community motivating a senior who is struggling, getting them back on track to then receive the news during our morning group counseling that that student was murdered due to gun violence, and another student sharing out that they saw it on social media. It is talking to a caregiver who has been impacted by gun violence and trying to be present for their child, but experiencing their own trauma, their own grief. It's listening. It's holding space for our staff who are experiencing vicarious trauma. It is meeting with a student during class in a breakout room because they are experiencing flashbacks of a friend who was shot and killed out front of their home. It is having students say and talk about being in their homes to watch TV or play video games over the weekend because that will keep them alive versus going outside. And lastly, it's having a student want to buy a gun to stay safe. The stories above create a small snapshot of the narrative that our school community is facing each day. Each day we get on the roller coaster to support our school. We are the gatekeepers of trauma. We are in a crisis and we need a plan of support. We need change. It is evident the impact of complex trauma. There is no time to process traumatic events during the volume of traumatic experiences that are impacting our students, our school community. The space for healing continues to be disruptive by the complexities of the growing needs. And it continues to highlight the need for more staffing, more programming, funding, prevention, intervention, education, and training. We cannot continue to normalize this. This is not normal. We are numb, we are tired, and we need to work together to change the narrative. I believe the space that we form in a school community creates the ability to thrive or falter. We need to be able to hold space and have our voices be heard. creating a school climate which teaches and guides our students of how to effectively use coping skills to alleviate their trauma reactions that they're experiencing is essential. It's a basic human need. We need to invest in our school communities and properly train, and educate each staff member to create this ripple effect. We need to be normalizing self-care for our students and for ourselves, and to be able to integrate this into the fabric of our school community. Camelot's motto is family. The power of connections with our students, caregivers, and partnerships speaks to the work that we are doing to create lasting change. As we think about the framework of trauma, it is imperative for our school community to have predictability, structure, and to decrease the chaos. Some of the daily systems that we've implemented to decrease symptoms of trauma start from the very moment of contact, right? This looks like our meet and greet by our caring adults, that we see you, that we value our students. We work to build the trust on a personal level with each student, holding daily town hall sessions for support of strengthening our community. This has been really successful to building the rapport and making meaningful relationships with our students, but also constantly assessing, right? Constantly checking in with our students to notice, is there a shift in their emotional presentation? Who may need a one-to-one check-in, as well as weekly advisory meetings. We're doing daily group counseling sessions where we hold a space for healing for our students to learn through also the support of social emotional learning, as well as doing home visits and one-to-one counseling supports. We have placed an emphasis on using trauma assessments to drive supports of our personal learning plans for each of our students in our school community. We know that therapy is essential, right? Students come to us in their most vulnerable state. It is important that we're able to hold space for our students to have them express themselves and know how to properly guide them through their traumatic experience. It is important to have the proper training, not only as school counselors, but for all staff to be trauma informed. We need to be prepared and to have the proper tools in our toolbox to handle these moments of distress. We may be the first person that the students, that our youth are opening up to. As we speak right now, the faculty from Camelot are completing training through the network of neighbors for psychological first aid and post-traumatic stress management. I cannot say enough of how appreciative I am for this partnership with Camilla Johnson and Yolanda Hughes. They are amazing, and we need to continue to bring additional resources and fundings to their program and program like this. Camelot staff is now able to be trained for free and to receive a accredited certificate for the investment of changing our school community. The partnerships that our school community develops has helped keep us going forward in this time of need. I cannot thank enough of the support of the Uplift Center for Grieving Children. They came right away to us when our student was murdered due to gun violence and offered us a space to hold for not only our students, but also for our staff. The support of the Anti-Violence Partnership of Philadelphia with Emily DiCarlo, the work that you do is amazing, and I thank you for all that you have offered us. But I want everybody to remember too, that the school day is just not 7 a.m. to 3 p.m. It's around the clock access that our students have to us. We know that the protector factors have caring adults in a life, right, that help promote the healing process. Students hold a connection with us, and we cannot continue to treat them like a business. What does this connection look like? It's receiving a phone call from a past student because their younger sibling was murdered by gun violence and they need somebody to talk to. It's going to the hospital to visit a student to show them that you care. It's meeting a student in the middle of the neighborhood because you haven't heard their voice and you're worried about them. You need to lay eyes on them and see them. We are the lifeline to many of our students. So the question is this: what services and supports are missing? I believe it's crucial that we develop funding to provide evidence-based, trauma-informed social emotional learning curriculums for our school. That we need adult social emotional learning with proper training for support. school counselors to be trained in CBITS or other trauma-informed care, mediation programs to help build conflict resolution, not only for the students, our youth, but for our entire school community, to provide support for compassion fatigue, to create environments for healings. We cannot continue to pour from an empty cup. To provide funding to help create authentic and engaging healing spaces in our school community with supportive furniture, accessory, materials to create and personalize the environment to meet the needs of our students. To create certification programs for students pertaining to trauma care and finding some way to make an elective course to count towards the student's school degree. To create trauma units in our school building for drop-in care, to offer incentives for therapy for trauma for our students to help build the buy-in due to stigma surrounding mental health and the lack of trust and the outreach for help. We need more of an open communication for the systems that are supporting us. Many of these programs look great on paper, right? But they're failing our students. From my personal experience, and I can only speak for myself, the IBHS program is an example of this. We cannot continue to have agencies partner with our school and work in silos. From my understanding, this program is to help support our school community, yet we feel so alone. When my student was murdered, I called in need of support, and I was told that they did not have grief support for the school community. This was a disservice to my school, neglectful and frustrating. I should not have to individually refer each student to a service when our school community is in pain and needs healing when we are in a contract for support. Or having 3 weeks to 3 months to have a referral be staffed for our youth. Or when my student is in crisis, not being offered the support because the worker did not make a rapport enough with the student and the family. These are just some of the many examples of challenges that I've experienced. Camelot Education does not have a STEP program. We are left to find the supports on our own. And lastly, to build and grow our community, we need to build partnerships within the community to make that connection, which we can create options for mentorships and give our students a better avenue. I leave each of you with a small outline of what is needed to help create change. However, this is a conversation that needs to continue with the actions to create a plan that will have lasting ripple effects on our school community for the ages to come. Thank you for your time and this opportunity.
Thank you very much. And I'm glad to welcome back my council co-chair, Councilman Johnson, to the space. Welcome back.
Thank you, Madam Chair.
I had a few questions, and then Councilman Johnson, if you wanted, Chair Johnson, if you wanted to ask a few questions, and then we'll open it up to the rest of the group. First of all, I want to thank the panel for your on-the-ground expertise. It really, similarly to what we heard from Dr. Lee and some other principals last week, what you are showing is how differently things look when we make plans on paper, but at the end of the day, they really have to get into school communities. They have to be felt by young people. And, the staff in school buildings need to be like the biggest supporters and cheerleaders of saying this is working. So we are going a little bit deep on what's not working because, we are in active meetings, for example, Ms. Pestrowski with IBHS. It will help to bring your testimony to them and also to be specific about some of the concerns that you raised. My first question is to the first testifier, Ms. Kraus from Uplift. And I wanted to know if you could talk a little bit more about your comment on issue number 3. Cities, agencies, I'll read it out loud again because I think it's important for us and it's something I've really struggled with a little bit more. So city agencies put into place violence prevention or similar functions often are not working directly with community-based organizations for input on program design or services which can result in underfunding of pre-existing programs, duplication of services already in existence. One of the things that we find out is that there's, when we talk about violence prevention, by failing to work more directly or having kind of like a map of your community-based organization partners, we just leave out whole groups of people who could be violent, our violence interrupters. And I think all of us are not saying anything surprising by saying it's highly, highly unlikely that many of the youth are going to go directly to the police, for example, as their first belief on who's going to be a violence interrupter. They'll go more likely to a longtime mentor, a family member that they trust, or somebody who has walked them through a process.
Excuse me, Madam Chair.
Mm-hmm.
Just 1 second. Can everyone put if you're not speaking and you're not on the panel, can you put your phone on mute, your computer on mute to drown out the background noise, please?
That could also be me, since I'm in City Hall, Chair Johnson.
Okay.
Those sirens are actually just around City Hall. So yes.
Understood. Go ahead, Madam Chair.
Yes. So I was wondering if Ms. Krause, you could expound a little bit more on that and maybe offer either some more, insight specifics. Chair Johnson and I are interested in not reforming things. We actually want to build these things that work. And so hearing some of your stories about what the gaps are will help us try to address, fix, or change things entirely. But that was one that really spoke out. So I wanted to give you space to expound a little bit more.
Thank you. I appreciate that. I was a little bit nervous to put that actually in my speech, but I've been at Uplift now for a little over 8 years. And so I've had the opportunity to both sit on different panels and, and to meet with other agencies that are doing really important work. And over the years, I've seen different committees get formed or different, offices get created under different administrations. And what I've often found is they might work with 1 or 2 groups, or they'll hear or we'll reach out to them and then they'll realize that we're here. But what happens is a lot of times things are getting, and it comes from a good place. It's always trying to to make change, to affect change, to put the government's, support behind it. But the problem is that without drawing on the community resources and and building on top of those, because there's so many good groups out there doing amazing work. I mean, we work with Amir Healing Center that, Shantae was here last week. And, AVP, was just mentioned. There are really strong groups that are already out and on the streets in the city doing this work day to day. And sometimes what I've seen is that committees will go off in a different direction and not work with these groups, or they'll work with one to the exclusion of others. And it really is one of these things that we're going to do better if we're all working together. And if we're working with groups that are already in existence, already doing powerful work, and have that connection.
And do you have a sense about why that is? I mean, is it because there's turnover, people don't know? Is there just not a map of what's available? Is it that it feels kind of ad hoc, or we're responding in crisis? What would you identify as some of the concerns?
It's probably a little bit of all the above, honestly. I think sometimes we are responding in crisis, right? When there's trauma, we oftentimes it brings about our own trauma response, right? And we act in that. But I really what was just referenced to me. I think the Network of Neighbors has done a tremendous job, and we work closely with Camilla and Yolanda. And I think they've done a great job of working on that coordination piece. I think there's a disconnect between the community and this maybe some of the government decision making. I'm not. That's the only thing I can guess, because I think that we all know who we are. When we're talking and when asked. But I think maybe a map, to your point, maybe having some kind of resource like that could be useful.
Mm-hmm. And then my second question is whether you can walk us through the process of grief, and because I think you talked a little bit about trauma and grief, and look, I think they're both, you know, they're tied into one another. We had a pretty intense conversation. We kept it private just because of the vulnerability of the young people who we spoke with, but I think all the members, most of the members on the committee, you know, had a chance to listen to some of them. You know, they spoke about depression, you know, that it's grief gone untended, trauma gone untended, becomes a longer term depression that, you know, maybe months later they are, you know, able to identify if they've had access to a counselor in between that. But they talk about depression that can also convert into either isolation or anger. And one of the things that we've been hearing from, for example, the school district of Philadelphia is they are not geared up. And some things that we hear a little bit from the city is that we're not geared up for long-term supports of individuals. And one of the things that I've been interested in is both, we need a crisis response plan very clearly. Like, you need to be able to respond to families in crisis. And I'm talking like 24 to 72 hour plan, you know, a first week plan, survive the first month, you know, then a 3-month, and then we can start to graduate out. But, you know, repeatedly we're told that we don't have long-term plans to carry individuals through. So can you talk about, you know, what that means, and from your vantage point as an expert in this field, how we need to be thinking about it, you know, and what would be the consequences, for example, of not dealing with some of this long-term?
Absolutely. So whenever I talk about grief, I say that grief is a lifelong journey, because it's not, you know, no matter when we lose someone, but particularly when we lose someone as a child, it goes along your developmental cycles, both as a child. So, you know, whether it's you're 4 years old and don't understand the permanency of death, or whether you're an adolescent and identify with the person that's no longer here and wish you still had that person here, or graduation, wedding, first child, beyond. So all these things, all these life events are moments where grief gets kind of brought back up. And so I really think that one of the most important things with grief is giving youth, which is primarily who we work with, but as well as caregivers, but giving youth the socio-emotional like skills to be able to process what they're experiencing, to be able to have the words, just the words for what you're experiencing, identifying the tough words. Maybe sometimes you're relieved when someone dies. I mean, but having those words to talk about that, and then having coping methods that are healthy, talking about healthy coping methods and helping build those into a child's life, helping them identify what caregivers they can rely upon. That's of critical importance. The literature is just completely is been resounding about that for years. That a caregiver that they can support, them, they can go to, and helping them identify that person and then figure out how to use the different people and supports in their lives. All of that is things that we do in our groups, but all of that is genuinely what kids and youth need when they're grieving. The literature shows that unresolved grief, it does lead to depression. It leads to anxiety. It leads to reductions in academic performance. It's hard to focus in class when you've lost somebody. I mean, you know, this makes sense to us as adults, but when we think about it for kids, it really can have long-reaching effects. So I do think that there's support that is needed for youth and around grief specifically. I know that some of the youth talked about having connections, and I do think that that's an important piece to somebody that they know and trust. And I think that, you know, we do that within our groups, but that's also why we work very closely with the schools. We'll go into schools and work with counselors that they know or teachers that they know. We'll work closely with, you know, we work with CHOP, and we have a site there, and they're the doctors that they see for their annual visits will make those referrals. So it's like that warm handoff is really important. But, you know, it really is something that that really cannot be ignored. And very frankly, grief's kind of having a moment, sadly, like just around the country right now with the pandemic. But it's a positive thing, in my opinion, because for far too long, people have kind of turned a blind eye to grief And I think that that doesn't serve anyone well, particularly children.
Thank you very much. I appreciate your responses. Thank you. Mr. Chairman, I'll turn it over to you.
Yeah. Well, thank you very much for your presentation. Very, very informative. I have a question for Camelot regarding the number of schools that Camelot is in, and really want to get down to. Well, first of all, again, thank you, Darcy and Samantha. You really touched on something that's really critical and important to me. It's my wish for the school district, as well as alternative schools and as well as charter schools, to really engage in some type of, what you talked about, trauma-informed curriculum and services, right? And through this process, we saw the number of young people who were shot and murdered in each three categories, as public schools, charter schools, alternative schools, and special ed schools, which shows the need to like beef up services and support for those children, because, you know, I'm trying to really look at how these young people processing all these murders and shootings that they're seeing on a day-to-day basis. And so I just want to get an idea from the Camelot perspective, how many schools are you in, and the support for services in those individual schools. And do you have numbers in terms of the number of young people that are from the district that have been assigned to Camelot schools?
So, Mr. Chair, some of the information that you are asking, I would have to come back at another time to give you specific numbers. I oversee 2 locations in the Camelot Education Provider Opportunity Network at this time. So one of the things I feel as though a lot of students present with normalizing the grief, that this is kind of something that is going to happen, that we've experienced. I think that a lot of times we don't offer a space to heal and to give that opportunity to feel grief, which is something that we're working with our students to be able to give the vocabulary, to be able to have the space to offer the supports as they're needed. And maybe it's not the first time, right? We might ask them if they need supports and to try to link, but maybe, you know, in the next week, the next month, the next couple of months, I'm continuing to have that open conversation at this time. So at this time, there are 5 schools within our school district that we service for Camelot Education and the Opportunity Network.
You say our school district, you mean the school district in Philadelphia, correct?
Yes, correct.
Just want to get an idea of that. Okay. And Camelot will be considered an alternative school, correct?
Correct. And our supports are embedded into our school curriculum as well, into our model.
Are the young people who are assigned to the school, is there any type of case management with these students who are assigned to Camelot schools?
So one of the things is it depends on the services that were put in place before they came into alternative education. So there usually is a hearing process. Sometimes there is identification of a step case manager from their previous school that may be referred. Some of our students may come in with already supports, but many do not. So really looking at our school provides a needs assessment, looks at each student and sees what supports do they need, and then we work from an individual basis going forward on how we can help support that.
Okay, thank you. I just want to say for the record, one key component that you talked about that some of our young people feel is that they normalize, and hear me out, Helen, they normalize the level of gun violence that they're seeing, the death that they're seeing, the shootings that they're seeing as something that's expected and is a normal part of our lives, particularly when you live in Black impoverished neighborhoods, right? And so, and the critical part about why we're doing this hearing, and I can reflect upon my own life growing up in Point Breeze, South Philadelphia, I didn't think I was going to live to see 18, but that was normal. It was like you don't know, right? Because of the shootings and the murders that are taking place in your neighborhood on a day-to-day basis, right? And even now that I'm 47 years old, I'm a father with 2 children who I'm raising in the Point-Breeze neighborhood. As I reflect upon just growing up in this neighborhood, like seeing shootings, coming up on the scene when a person is murdered, right? And how do you process that in terms of me just being a young man just living inside the neighborhood and how I go about my day-to-day life? And do I become more aggressive in terms of carrying guns for protection or to defend myself? Do I act out in terms of my behavior when a close loved one or a close friend that I've grown up with from the sandbox to high school is murdered, right? How do you process that if you don't have a positive outlet in terms of family members or extended community members to kind of really invest in you and kind of give you that space to kind of talk about how you feel in an environment where, particularly being masculine, you don't want to share how you really feel, what's really, really going on. If you really, really are hurt. And I see a lot of that when I'm speaking at funerals, when a young person is murdered, right? After the funeral, how young people are processing their feelings, either retaliation or medicating through smoking marijuana, Percocet, Xannies. And I'm just speaking of real life experience in terms of me being involved inside my neighborhood. So you just kind of highlighted some things. That's why it's critically important that the trauma-based support is really ingrained in our education system, right? And also on a macro level, how our communities are suffering. Because if you're seeing children dying or being shot on a day-to-day basis, and you live in those neighborhoods, not only the family members are impacted, but the residents and the neighbors who are living in this very same environment, who, let's say, you send a young person to the store from the time that they've been a kid until the time they're a teenager, you're watching them go on their prom, you're watching them grow up, you're watching them have children, you know the family member, and then that next thing you know, that person's life is taken tragically to some senseless gun violence. How are the little brothers and sisters or little nieces and nephews or cousins, how are they processing that information when they go to school or when the family members go to and from their home? And so you really hit something to the core when you talk about that level of trauma support and ingrained in the actual curriculum and services of how we support our young people. So Darcy and Samantha, I just want to thank both of you for your hard work and your dedication to this work, and really being essential workers, you know, on the front line. Because, and I say this, some people, and I don't want to take this as a cliche, but I honestly believe we don't have no other precious resource here in the city of Philadelphia than our young people. That's just how wholeheartedly how I feel about on the work that all of you doing while we're taking time out of our schedule to do this hearing. And so just want to thank you. Madam Chair.
Yep, thank you. No, thank you, everybody. Thank you, Mr. Chair, and thank you, everybody, for your testimony today. We'll look forward to following up. And Ms. Petrusky in particular, we may be sharing some of your testimony with within our internal IVHS group. Councilmember Quinones Sanchez and I are both on that internal working group. And so if you want to send over additional information about how to improve that particular program, I think it would be extremely helpful right now. So, and we'll absolutely take your recommendations to heart. Thank you, everybody.
Thank you. If there are any other questions and comments from members of the committee? If not, will the clerk please call the next panel?
Ronald Crawford and Farida Boyer.
How are you? Can you hear me?
Yes, we can hear you. Just state your name and title for the record. And I'm going to ask Ron if Farida Boyer can go first, ladies first. That's how my Nana taught me. And so, Ms. Boyer, state your name and title for the record and begin your testimony.
Okay, give me 1 second. Good afternoon. My name is Farida Boyer. I'm a licensed marriage and family therapist, and I'm a approved supervisor. I have a nonprofit organization called the Black Brain Campaign, where we help to eradicate the stigma against mental health in the Black community. And I have an outpatient private practice and located in West Philadelphia, where we provide individual counseling, family counseling, couples counseling. I also sit on the advisory committee for the Office of Mental Health and Substance Abuse Services for Pennsylvania. So thank you for having me today as we attempt to address trauma in the city in the city and find solutions to address the high crime rates and gun violence. We have to look at the core experiences of psychological trauma and how it disempowers and disconnects us from others. Studies have shown that the advanced part of the brain is not fully developed until the age of 25. The prefrontal cortex matures between the ages of 12 and 20, where the most sophisticated of our abilities reside, including our emotional control, impulse restraint, and rational decision making. Adolescence, youth, our young adult behaviors can be adolescents and youth, young adult behaviors can be rectified. However, it depends on our response to their behavior. Our response needs to be clear, direct, and carefully crafted to teach challenged youth to be functional adults. Recovery of trauma is based upon the empowerment of the survivor and the creation of new connections. The purpose of therapy is to promote the recovery of the patient. You cannot fix a child without fixing the entire family. Often parents and caregivers come to therapy with an attitude of the child being the identified patient or the problem. As therapists, we cannot fix the child without fixing the family at large. As a community, we see the influx of violence, and it not only impacts the person who was involved, it impacts the entire family and ultimately the entire community. Therefore, the city of Philadelphia should recruit more marriage and family therapists because we are trained to look at the family system and not just the individual. The root causes of trauma are not limited to violence. They are often caused by past and present discrimination against people of color. Discrimination against people of color is a tangible basis of minority distrust in the majority society. Therefore, many people are reluctant to participate in therapy, especially with someone who they view as an oppressor. In the Black community, there's a major barrier to seeking services because we, Black people, were taught what happens in this house stays in this house. Therapy is all about establishing a healthy relationship and should be a model for other healthy relationships. That is why it is imperative that therapy treatment begins in the early stages of development to ensure the optimal results. It is necessary to ensure culturally effective therapists are available to meet the needs of our community. As a clinician, I've been trained to think systemically. This approach in therapy and in supervision includes awareness of differences of values, attitudes, and ways of understanding the world and the influence these have in our professional work. Most of my work experience have provided me the opportunity to support people of color who live or work in the Philadelphia area. At least 90% of my clients have experienced some type of traumatic event or knows of a close relative or friend who has been impacted by the ongoing violence in the city. As a co-founder of the Black Brain Campaign, we created LEAP, the Licensure Education Assistance Program. And this is to address the issues of the lack of licensed therapists and supervisors of color. LEAP has provided master level therapists with supervision and covers the cost of licensure exams. And the reason why I'm bringing this up is because in order to sit on a panel, your Aetnas, your Independence Blue Cross, you have to have a license. And many of Black clinicians don't have licenses but they do, and they're eligible to work for CBH, which provides most of the care for the citizens in the city who face some type of trauma. So in turn, therapists are required to provide therapy for those in need. The Black Brain Campaign offers 8 free therapy sessions to those living in the city or in Pennsylvania who need therapy. The increased demand is positive. However, there is not enough culturally competent therapists to meet the needs of those who request services. There has been a 25% increase in homicides in the city of Philadelphia. I'm sorry. Okay. There's been an increase in homicides in the city of Philadelphia since 2020. Each year, the numbers continue to rise. While the Black Brain Campaign welcomes all who are interested in receiving service, and we appreciate referrals from the cities and other agencies, but like many of you, therapists are becoming overwhelmed and overworked. My recommendations are as follows. To utilize an integrative approach to therapy treatment. An integrative approach would include all services and organizations involved in a person or family to meet collectively while assisting a family with meeting their basic needs and holding those in positions of power to ensure the simplest of the family needs are being met. My second recommendation is culturally competent therapy should be placed in every school to establish a healthy relationship with students in need of support. My last recommendation is mental health and wellness should be viewed as equally as important as physical health by providing resources that reflect this priority. Thank you.
Thank you very much. Mr. Ronald Crawford.
Good afternoon. Can you hear and see me?
We can hear you, Mr. Crawford. Yes, now we see you. And first and foremost to Mr. Crawford and Farida, the same thing for Samantha and Darcy, who was just on here. I thank y'all for, one, being patient with us. I know we went over time last week for this hearing, and I thank you for being patient to come back this week to provide this critical and important testimony that will help us as we address this senseless issue of gun violence, and most importantly, trauma amongst our children. So I want to both say thank you to both of you two. And Mr. Crawford, please begin your testimony. Just state your name for the record.
I'm Ronald Crawford. I'm a therapist who works in North Philadelphia. First of all, good afternoon, Councilmember Gim and Councilmember Johnson. Thanks for inviting me today. I appreciate your interest in my work and the opportunity to share my ideas about reducing gun violence in Philadelphia. As I said earlier, I'm a therapist who works in North Philadelphia, and I work with those who are recovering from mental health challenges, substance abuse, and incarceration. I like to start off by telling a story. It's my story about growing up in the North Philadelphia area in the 1970s. I grew up in poverty. I grew up in Philadelphia at a time when the streets were ravaged with gang violence, and I grew up in a household where I witnessed domestic violence. In fact, I'm a survivor of complex trauma, and I could have benefited from therapy when I was young. Unfortunately, I didn't get therapy, and this was because I didn't want to appear weak or crazy, and I couldn't tell people what was going on in my household. I went to 2 therapists, but I just didn't connect with them, so I never went back. Unfortunately, for the next 10 years, I started self-medicating my feelings of depression and my experiences of trauma by using drugs and alcohol. In 1990, I got clean, and I haven't used drugs and alcohol for the past 30 years and 8 months. I say that because I usually don't share my personal story. A lot of it has to do with I don't want to seem like trying to pimp my trauma or get kudos for doing some of the stuff that I should have been doing all my life. I say that for a few reasons. First reason, I wanted to acknowledge that I share lived experiences with many of the Black men that I work with. And this allows them to identify with me in ways that they can't identify with therapists who just have educational experience. Another reason why I shared my story was I wanted to acknowledge, like many of those that I work with, there have been times in my life where I needed therapy and I didn't get it, possibly because I just couldn't find a therapist that I could connect with. Still, another reason why I shared my personal story was to show how my recovery from addiction and mental health challenges caused me to look inward, look at my life, and realize that my approach to life wasn't working and needed to be changed. The last reason resonates with me the most, and that's because I believe that the city of Philadelphia has to look at what we've been doing to address gun violence and realize that it hasn't been working and our approach needs to change. Over the past 20 years, I've worked with predominantly Black people in North and West Philadelphia, and my goal has been to address cultural disparities and addressing behavioral health care services. Since my interest is in emotional wellness of Black people, I was surprised that last week I heard a lot of discussion about supporting people in Philadelphia who had experienced violence, but I didn't hear the concept Blackness used as often as I would like to. I heard people speaking to poverty and, white supremacy today, but last week I didn't hear it as much. That was problematic to me because when I hear people talking about offering therapeutic services to people and don't mention Blackness, I'm afraid that they might use a one-size-fit-all approach. And when that's done, Black people suffer because we have different needs, different ideas, different values, and different language. So I'm going to talk about how Black people are resistant to therapy and how, like the person who spoke before me, that could be eliminated with the use of culturally relevant counselors. My concerns about Blackness being addressed was because many of the programs that my colleagues shared about last week, I'm afraid that though they may be good ideas on paper, they might not be effective for Black people. And that's because they might use the same strategies and the same kind of therapists that have been woefully ineffective to Black people for years. This is why I introduced my expression of cultural relevant counseling. It helps Black people recover from the experiences of violence as victims and perpetrators of violence. For the past 20 years, I've helped people change unproductive behavior. And I've learned that before a person changes a behavior, they have to change their values about the behavior. Violence is a learned behavior. So before people can unlearn or change this behavior, they have to change their values about it. Insights such as this make me wonder why professional helpers, counselors, social workers, and therapists aren't more involved in offering solutions to the gun violence in Philadelphia. I hope that today, and I believe that we should be on the front line because I think that we have insights that the average person, however well-intentioned, just don't have. I hope that with me coming here today, I can start the discussion about making professional helpers and other therapeutic concepts more prominent in our response to gun violence in our city. Philadelphia is one of the most violent cities in the nation, as its homicide rate was second to Chicago last year. What's troubling is that this violence occurred amid a coronavirus pandemic, and it seemed like the shooters weren't practicing social distancing like the rest of us. Many of the, I think that the uptick in homicide rate in Philadelphia and across the country was due to the coronavirus pandemic, and I want to give you an example of why I feel that way. Many of those that I provide therapy to are involved in the criminal justice system, so many of them are on probation or parole. Unfortunately, many of these people that are on probation and parole, they haven't seen probation officers face-to-face in about a year. And what that does, that creates people who are carrying their guns more frequently. People are using drugs more frequently because they're not worried about being tested by a PO. And you gotta imagine that that increases the likelihood of violence. I believe, and I'm gonna go on a limb and say this, that when POs start seeing people face to face, there's going to be an increase in the need for drug and alcohol services because a lot of people are going to be testing positive because they've been using drugs for the past year. And because most probation officers don't want to fill up the prisons with people using drugs, they're going to send them to treatment. And treatment centers are going to be overwhelmed. This is why I come to you with one of my ideas about starting my own treatment facility that offers trauma-informed drug and alcohol treatment to people in North and West Philadelphia. People who experience violence can either be victims of it or witnesses of it. And many of those who experience violence in Philadelphia are young Black people. Therapy can help many of these people, but they're resistant to getting therapy because the stigma associated with having a mental health challenge or needing therapy. I address this resistance by using cultural competence as I integrate their home culture into my therapeutic approach. Research has shown that when a client's home culture is integrated into a therapeutic intervention, that increases the buy-in. They get more comfortable, they feel more relaxed, and they have better treatment outcomes. Many of the young people who experience violence in Philadelphia are members of the hip hop culture, as their values, language, and taste in music, clothes, and drugs are influenced by hip hop. Integrating hip hop culture into therapy makes it culturally relevant, and this makes people of color more willing to receive therapy. This willingness can increase retention, which can improve the therapeutic experience and therapeutic outcomes of people of color. Hip Hop Psycho Ed is a program that I've developed where I integrate an analysis of hip hop culture and evidence-based counseling strategies. And it's actually a therapeutic intervention where I educate members of the hip hop culture about their psychological needs. In hip hop psychoeducation, an analysis of hip hop culture and the themes in rap song is used to change values about violence, mass incarceration, drug use, and sexual behavior. In hip hop psychoeducation, healthy behavior is promoted, and one such behavior is reading. Reading books can promote family and community inclusion, as people and their friends and family can go to libraries and bookstores in the community. Bibliotherapy is a therapeutic strategy that uses books to help people develop coping skills. In 2019, I wrote and self-published a book titled What's Free? It Ain't Being Booked or on Paper. And in this book, I use a therapeutic analysis of Meek Mill's legal experiences to discuss how the hip hop culture has been impacted by mass incarceration, gun violence, and the opioid epidemic outside of Kensington. I said outside of Kensington because a lot of times we just focused on people who don't live in Philadelphia but go to Kensington and get lost. But what a lot of people don't know is that a dangerous trend in hip hop culture is the fact that some of the more popular rap artists glamorize the use of opioids as party drugs. And what young people don't know is that 80% of heroin users started out by abusing Percocets. In hip hop psychoeducation, I promote emotional wellness and increased literacy. And reading can be a culturally relevant violence prevention strategy when you consider that in jail culture, people who want to stay out the way, they just go to their cell and read. If you talk to people who have been incarcerated, you'll find out that many people haven't read their first book until they went in jail. So what I try to do is I try to write books that integrate hip hop culture, sprinkle in some behavioral health information, and help people understand that it's cool to get counseling, it's cool to ask for help, and it's cool not to get locked back up. Since 2019, I've collaborated with the City of Philadelphia on a few initiatives, and those initiatives involve parts of hip hop psychoeducation and bibliography. In 2019, I was awarded a grant from the Department of Behavioral Health and Intellectual Disability Services that's
Ron, I think you have a technical difficulty. Let me check and see. One second, everyone. So in the meanwhile, I'm going to do this. I'm going to ask for Councilman Green to ask his question of Farida Boyer.
Thank you, Mr. Steve. Thank you for all willingness to your passion and reference to work. Ms. Ford, thank you guys for the Black campaign and your
Is he
Councilman
breaking up or-
Green?
Okay.
Yeah, just 1 second. Somehow you're breaking up as well.
how about now?
Now is perfect.
Okay, so, yeah, I was just saying, Councilmember Johnson, Mr. Chair, thank you for your work and advocacy in this issue and your passion and always willingness to share your personal motivation and what drives you in the work that you do. Ms. Boyer, thank you for your leadership in creating the Black Brain campaign and also your clinical work in our community. And actually, Mr. Crawford also provides some excellent testimony I wanted to touch on. Today, as the other chair of this committee, Councilmember Gim, talked about the mayor's budget address, and we had a conversation of need to be bolder in what we do in reference to addressing these issues. Can you still hear me? Okay, making sure. All right. I've been dealing with some tech issues today. But from Ms. Boyer, I'm just curious from your perspective, considering some of the lack of resources that have come to culturally competent providers, and I've had conversations with Asher Kemp and the coalition and various members of that coalition over the years addressing these issues of violence, and how we're not giving or providing those resources to those organizations that really can have a real impact. And you talked about a more holistic perspective, not just the youth, but the entire family. I'm curious any thoughts you may have in reference to this budget process. You laid out some suggestions as we start this budget process with today's address from the mayor. We'll receive about $1.4 billion in revenue that will help us with our $450 million deficit, but also will provide additional dollars to do different things. And when you look at a homicide rate of 499 homicides last year, we're already ahead of that this year. I'm just curious from your perspective, what are some of your additional thoughts on how those dollars can be spent within some of those suggestions that you provided?
I think it needs to go directly to the community. I sat and I'm just thinking of, I look at some of how the larger agencies get most of the funding, but the smaller agencies are in the community doing the work. And not to say that they're not doing the work. I notice a lot of times, and this is why I try to refrain from this, that we talk to the administrators, the directors, but we rarely talk to the people who are doing that actual work, who understand. And although I'm an administrator, I still have a caseload of 20 clients that I see a week. So I still have my ear to the street. I understand what's going on. I'm still providing the actual service. It's a difficult balance, but you can't just talk to the administrators. You have to understand what's going on from the people who are doing the actual work. So what I would like to see is some of those smaller agencies that's doing the work get some of those fundings. When you look at a PHMC versus a Warren E. Smith, now you have a lot of culture. When I say culturally competent agency, it's the Warren E. Smith, it's the consortiums. We're in the community providing the work, but we're the ones who get the less funding. And that becomes a problem when I talk about the importance of licenses. How is it that, or why aren't we getting the funds that we need to become licensed, to have proper supervision? And I didn't have the intentions on saying this today, but I'm going to say it because I feel like it needs to be said. It's an issue for me that you go to school and you get a master's degree, you have to go through and get this license. You can't afford to do all of that off of the funds that you're getting. So there's a transition. I can't make the money I make at this agency, so I'm gonna go to the next agency, which it directly impacts the client, because if you can't stay with your therapist for a certain amount of time because they're transitioning because they can't get the money they need, you're not getting a proper service. So you have a lot of transition in that way. So those are the things when you look, we have to start looking at it systemically. You have to look at it systemically to see where it comes from. And it just trickles down. And when it is directly impacting the community, it directly impacts the community, and we just have to do better with it.
Yeah, you made a very good point. Just thinking about, my own path with my son and, trying to maintain a person providing service, especially when we're talking behavioral and mental health, and having longevity is very important because you develop those relationships. As Mr. Crawford was talking about, so often, especially for Black men, and as you, Ms. Boyer, said earlier, we don't talk about that. We keep that in the house. And I heard you say over and over and over again, that's so true. We don't talk about those things. That's, you keep that in your home. And then when you look at Black men in particular, we don't express that type of emotion because we're not supposed to be that way. We're supposed to be a certain stereotype that unfortunately sometimes we buy in too much, and we're holding all of that pain and suffering inside. And then it's like 1,000 cuts, and then one additional cut can cause that explosion because you're not having an outlet and a release and not talking to someone. And you could be with other Black men all dealing with the pain. The same pain, won't tell each other you're dealing with the same pain because we don't do that. And that's within the family, let alone African American men. So that type of perspective is so important when I think about my own son, and then talking with other people that have children on the autism spectrum, and they've had multiple type of either therapeutic support service people or behavioral support coordinators, or all those acronyms constantly changing over. You can't get a consistency of care.
And therapy is all about a relationship. It's about establishing this relationship with your therapist should be a model of what your other relationship should be like, because it's built on honesty, it's built on mutual respect and trust. So if you have time to establish that, you can see a difference, and it takes time. One of the things, and I'm gonna stop talking. One of the things that I realized, they want you to do it in a quick fix. Well, for 47 years, I've been behaving this way. So you can't change my behavior in 12 weeks. It just don't happen. So I have clients that's been on my case for a year. So we have to look at that. The first day that you meet with me, you want me to give them a diagnosis. I barely even know them, but you want me to attach a diagnosis to them. That's not fair to them. So, and then you want me to rush my treatment. Well, I have to get it takes about 5 to 6 sessions to get to know a person, right? Then they have to feel comfortable with sharing and being honest with me. And I'm gonna be real, most Black people feel comfortable with sharing their experience with other people. And I'm gonna put Councilman Johnson on the spot just for a second, because he said something to me one day. He said she was cutting, right? Now, when he said she was cutting to me, because I'm in the clinical world, I'm thinking, okay, she's really cutting. But he meant cutting up, right? He meant cutting up. But if you don't know, if I didn't know what cutting up meant, I'm gonna assume she's cutting. Like, she's cutting. Do we need to assess for homicide or suicide? So those are the things when you talk about being culturally competent. Some other clinicians may not know what cutting is.
Right. And that is so true. And that goes back to what Mr. Crawford was saying about that competency, because someone not having that full perspective that you have, that has that duality of, like, I understand the clinical perspective, like, okay, this person actually cutting themselves, or from the perspective, from the community perspective. And so you were able to ask those additional questions to get a real sense of what's going on, whereas a different provider may have not had that perspective to ask that additional question, and is now moving in a different path of what they think is the proper therapy and treatment, when it's actually not the total case without that full perspective. Yeah, that's why I think this whole conversation is important. And I want to thank both Councilmember Johnson, Councilmember Gimm, and also you, Ms. Boyd, and Mr. Crawford, who also provide that perspective, because we do have to have this bolder perspective of how we're dealing with these issues. I was listening to Solomon Jones this morning, and he was talking to a friend of mine, Eric Williams, who also has a son on the autism spectrum, but he is doing this program called Shape Up in West Philly. And he's talking about, they're giving young men a hug, and how for some they're like resistant because they're just not used to seeing that type of interaction because it's so foreign. And then and just like you said, people who have not had treatment or support for decades, and then you're trying to do a quick fix.
Exactly.
And then when you're talking about the black brain, unlike other type of injuries, if you break your arm, break your leg, you can see that injury. Can't see the injury that may be occurring here or occurring here. That takes time to develop the relationship to even be exposed to what the real injury is.
So,
Thank you, Mr. Chair.
Mr. Crawford, no, thank you, Council.
Yes, sir. Yes, sir.
Thank you, Councilman Green. Mr. Crawford, you want to finish your
Yeah,
testimony?
I apologize about the technical glitch. I'll just run through this as quickly as possible for the sake of time. Like I said, over the past 2 years, I've collaborated with the City of Philadelphia, the Department of Behavioral Health and Intellectual Disability Services, and the Office of Violence Prevention. With a grant from DBHIDS, I developed the Hip Hop Psycho Ed Workshop Series, which was a series of wellness groups in Philadelphia communities where I engaged males of color about their mental wellness. The project promoted literacy through group discussion and by partnering with Black-owned bookstores in the community and giving participants a total of $4,000 worth of $25 gift cards that can be used to buy books at Uncle Bobby's Coffees and Books, Hakeem's Bookstores, and Black and Nobel. With the grant from the Philadelphia Office of Violence Prevention, I developed the MASH project. MASH is an acronym for Mental Health Support After Stuff Happens. And this project was a series of 20 free wellness groups that were facilitated in Philadelphia communities impacted by violence. The trauma-informed groups provided a safe space for residents to share their experience of violence. Unfortunately, the coronavirus pandemic prevented the project from achieving its goals, but as soon as the city eases its social distancing guidelines, I plan to continue my partnership with the Office of Violence Prevention and resume the wellness groups that are part of the MASH project. I hope that with the support of City Council, I can continue my collaboration with the city, and I have a few specific ways that you can support me. I'm in the infancy stage of developing trauma-informed drug and alcohol programs in North and West Philadelphia, and I can use help in the following areas. First of all, I need help securing a research grant so that the effectiveness of hip-hop psycho ed can be tested. There's a lot of talk about evidence-based practice, and all that really is just an intervention has been tested for its effectiveness. And we need to remember that all evidence-based programs, before they were tested, were just good ideas that people thought could work. Now, City Council could feel that this integration between hip-hop culture could be effective in reducing gun violence, that'll go a long way in helping me getting this program tested. I also need help getting into the provider network of CBH, because as someone spoke earlier, CBH is the care manager of Medicare, and you have to get in their network in order to provide drug and alcohol treatment services for people in communities that have been impacted by violence. I'm looking for a place, so if you know of anybody that wants to lease a suite for a small outpatient program, let me know. I also need access to the Department of Corrections, the Pennsylvania Department of Probation and Parole, and diversionary programs like the ones that PHMC facilitate called the FUR program, Juvenile Treatment Court, and Mental Health Court. One of my goals was also to have my latest book, What's Free, It Ain't Being Booked on Paper, a part of the Philadelphia Free Library's signature project, One Book, One Philadelphia. This project promotes literacy, library usage, and civic dialogue by encouraging City of Philadelphia residents to get to read a book and come together by discussing that book. When I reached out to the Free Library about my book, What's Free, they told me that they weren't interested because they have a list of books that they use. And I understood that, but I was kind of confused. I was like, at that particular time, couldn't Philadelphia use a book that supported people getting counseling to address mass incarceration, violence, and the opioid epidemic? So if you can do something, to help me push that agenda, that would be great. That's all I have for today, but I'm willing to answer any questions that you may have. Thanks for having me.
Thank you, Mr. Crawford, for taking time out of your schedule. And before I call on my colleague, Councilwoman Jamie Gaudier, One, I want to acknowledge you for your hard work and your dedication around this issue. So you gave us a to-do list, and so if you make sure I get a copy of it, that would be very, very helpful. There's a couple things you touched on that's really, really critical and important. One, you talk about we have gun violence, but before we have gun violence, we have the issue of violence, right? And in order to change the violence, we have to change what we value, right? And I just think about also how you talked about how this has to be addressed, particularly as a Black issue around trauma and gun violence, just because of the nuances on how we value certain things. In case in point, in most households, right, we were taught. Well, I'm 47, so I was taught if you hit me, somebody hit you, you hit them back, right? Somebody bigger than you hit you, you pick up something and you bust them in the head, right? Now, obviously, being a dad, I'm 47 with two toddlers, 4 and 6, and I think a little differently because these days, if you put your hands on somebody, you may not come home, right? Because it's not the days of giving out a fair one. It's the days of picking up a gun picking up a gun and taking the life of another individual. But my point is really getting to the root causes of that valuing of violence as a way to resolve a dispute, resolve a conflict, and most importantly, in some cases, how you express yourself, right? Because we know hurt people, and so if it's not a gun, you may pick up a knife. If it's not a knife, you may decide to wall up and hit somebody inside the head, right? And we're talking about getting to the root causes of why some of our young people react the way they act when it comes to the issue of trauma, which leads me to hip hop culture. And I'm glad how you intertwine the hip hop culture into addressing the issues of trauma, drug abuse, as well as gun violence. Because when we look at all the good work that we're doing and we're trying to do to save our young people, we're competing against what I call street culture, street life. And I started my organization, Peace Not Guns, as a result of a cousin and several friends being murdered, and I started teaching young people conflict resolution, anger management, but most importantly, anti-street message, because I understood just upon my own personal experiences in growing up and really enjoying the street life, right? Just having a frank, transparent conversation, because you have to look at all that comes along with it, right? It's the masculinity, the girls, the fast cars. If you have a reputation, maybe that person as quote unquote the man, right? But also our young people don't see that the streets don't love you back, right? That's the people getting kidnapped, that's the shootings, that's the murders and all that comes along with it. But getting to the root causes of how our young people process living in that environment on a day-to-day basis. And so I don't know, hopefully the wider audience really caught on that we had, and both Farida said it as well, I guess y'all said culturally competent individuals from a therapeutic standpoint addressing this issue. And so I was going to ask the same thing Councilman Derek Green asked Farida of you. How do we integrate and how do we make sure that culturally competent therapists are a part of our strategy when address this issue of gun violence? And you actually gave like a bullet point. Here's some things you can do to help me, but just give me, in summary, and I've seen you say this before on social media, right? Like, why aren't the therapists at the table? So, and it's the same thing Farida is saying, but I want to hear from you. How do we integrate as a city? I know what you talked about in your particular programs, but let's talk about on a macro scale, because obviously you two, as an African-American woman and as an African-American man, who are both therapists on the front line, I'm quite sure you're speaking for other African-American women and men who are therapists who are on the front line. And so from your perspective, how do we integrate family therapists who are on the front line in our fight against this gun violence?
Well, in striving to be culturally competent, there's a few things I need to do. I need to learn about the culture that I'm working with, respect the culture, and understand that if there are beliefs that I have that will prevent me from helping this person, I need to get somebody else to help them. cultural sensitivity in language. I was listening to you guys talking about the cutting thing. I want to give you a quick example. When I approach people in North and West Philadelphia, to be transparent, I'm not dressed the way that I'm dressed today. Because when I'm dressed this way, I look like an outsider. I'll probably have a hoodie on, some Timbs, some jeans, and I look like the people that I work with. I talk like the people that I work with. And then when they get to know me, you know, we share similar experiences. I went to some of the same schools, and I have lived experience in recovering from therapy. So I'm just like you. It's important to speak the same language, but that can be difficult. I was watching a white therapist was having difficulty using the language that's used in Black culture as a person who was charged with killing someone. Why did you shoot him? He said because we got into an argument. And he told me he'll be back. She was puzzled. She was like, "You mean to tell me you took somebody's vote because he said they'll be back?"
But
When
Ron,
you come from,
where I grew up at, when you say you be back,
right,
I know what time it is. So
right. So she didn't get the language. She didn't get the language. When you say I'll be back, I'm going to make sure you don't leave, because I know that means you're going to go back and get your gun. And if I'm here when you get back here, I'm in for trouble. So one of the things that we can do, we can normalize therapy by, we have peer supports, we have violence interrupters, people who have been in the streets and who have recovered, helping people get out of the streets. We should also use the peer support or the certified peer specialist model, where use therapists who have gone through therapy themselves to tell people, hey, it's cool to have depression. It's cool to ask for help. Because, and this is the last thing I want to say. When you understand African-American culture, you understand that we don't even know how to function in therapy. We don't have the skills. There are a few skills that you need to be able to do well in therapy. One of them is you have to learn how to ask for help. You have to learn how to first admit that there's a problem. You have to learn how to express feelings, and you may need to cry every once in a while. All of those skills, we as Black men were taught not to do. So when we get to therapy and we're expected to do those things, like the person that spoke before me said, it takes a long transition. Like there are certain therapeutic models like CBT that give you 12 sessions. They don't work in the Black community because it takes 8 of those sessions just for me to get to know you. So I agree with what the person was sharing before. I was nodding my head. So there's so many things that we can do to make therapists more culturally competent. You just gotta let us come to the table and talk to y'all.
thank you. Councilwoman Jamie Gaudier. Councilwoman Gaudier,
Thank
are
you,
you still
Mr.
there?
Chair.
Yes.
I'm here. Can you hear me?
Yes, I can. Yes.
Okay. Thank you so much, Mr. Chair. I just really
I'm jealous
wanted
you
to.
outside, but it's all good.
The beauty of being virtual.
Absolutely.
I just really wanted to thank the panel, Ms. Boyer and Mr. Crawford, for their powerful testimony and for their work and for their advocacy around culturally competent mental health services. So thank you so much for being here today and sharing what you shared. And, you know, I commit myself to being a part of finding more support for these type of services in our communities, especially at this time. And I also wanted to thank Mr. Crawford for his work in West Philadelphia and to volunteer to be a part of getting his to-do list done. I mean, it's a long to-do list, so, you know, we'll probably have to double team.
That's right.
But I
That's
think
right.
together we can
right.
help him to get some of those asks fulfilled. So thank you so much.
No
Absolutely.
problem. I'm sorry the list was so long, but I had to shoot my shot.
Well, thank you, Councilwoman. We appreciate that. Yeah, Ron, make sure you give us a follow-up because we want to be supportive of your efforts. Again, you know, I ran into you a couple times, right? And I know you've done some workshops also down in South Philadelphia at Vera Rec Center prior to the pandemic. And so we want to make sure that the mission that you and Farida are talking about, and that's really been on the front line, because something that Farida talked about as well I want to do a deeper dive on, and I'll follow up with my colleagues for some assistance around this, is how do you get those major companies like PHMC and CBH and what's the other one? DBHIDS, Dr. Jill Biden, and so forth. Like basically, these are the majorly funded organizations, Councilman Green. And at the end of the day, and the council president talked about this the other day during our violence prevention and opportunities agenda press conference. We have to re-examine. This should be a paradigm shift, right? Because re-examine when the major corporations are getting the funding, right? But they're not in the communities. They're not on the front line. And a lot of them get evaluated by doing numbers. They may partner with the Black Brain Campaign, and the Black Brain Campaign may bring 100 people out to their event. But those 100 numbers will go toward helping them get a grant to expand their budget, right? And so I know how all of those types of partnerships work, but we want to recognize individuals who are culturally competent, who are on the front lines from a behavioral health standpoint, supporting our young people, supporting our families, because we recognize that even though we're seeing this level of gun violence that we're seeing right now, we all come from neighborhoods, particularly if you're African American, you live in neighborhoods that have been experiencing trauma since slavery, right? And so when you talk about the issue around police brutality, I remember, not only just the Rodney King issue, but I remember my dad telling him how Columbia Avenue was burned down because there was a rumor that the cops had did something to an African-American woman at that particular time. And so we've always dealt with some level of trauma, but this issue is so critical because something you talked about as well, Ronald, is how we express ourselves. And most young people self-medicate, right? Yes, it's not just Kensington. No, I mean, at any high school, when school was in, you can go outside and see a bunch of young people smoking marijuana in front of the school, right? No different than them taking Percocets, right? Or Xannies. And so, I applaud Meek Mill because I remember, I know you wrote a book about, his situation and how it relates to hip hop and mass incarceration and gun violence. I remember him talking about his struggles, right, with being addicted to Percocet and really taking a stand, telling young people, like, that's not the direction to go, because that's the gateway to heroin. And, like, that's not what we about, right? And it was so powerful because they're going to listen more to him than to a Councilman Derek Green or Kenyatta Johnson, right? And so that message of hip-hop being intertwined in terms of how we capture the minds of our young people and really meet them where they're at, right? And get them to think about things differently when it comes to trauma, processing their trauma, which we know has a significant impact on how hurt people when it comes to the significant issue of gun violence. And I'll wrap on this. I was talking to some young men the other day saying, well, let's get to the root cause of why we see these gun shootings, right? And it was a real simple response. It said, you know what? If you kill somebody, man, or their homie, right, you're going to see a continuous cycle of revenge because you killed my man and I got to go back and kill your man, right? And it's a continuous cycle, right? But at what point do we get to the part where we resolve that conflict and really is addressing the hurt? Because it's a sense of pride that you got to retaliate for your homie's life who was taken away. And that's why you see that repeated cycle. And no one's going to really sit down and say, well, they're going to talk about the hurt, right? But I got to also protect that image and that pride and do the retaliation. And so with that being said, I thank the two of you for taking time out of your schedule to adding to this dialogue, which was very, very informative and helpful. And again, Ron, make sure you follow us with your to-do list, as well as Farida, any way that we could be supportive in the Black Brain Campaign. I would like for every member of City Council to know the services that the Black Campaign has to offer. You said 8 free sessions, right? I'm sure that there's some individuals that we all interact with that can take advantage of those free services. Now, I don't think PHMC reached out to us, Councilman Green, and said, we provide free services for young people who are experiencing a level of trauma or their family members. And if they did, no one has provided that information. to my office. But Farida, we like the work that you're doing. Keep up the good work. Ron, we like the work that you're doing as well. And with that being said, let me make sure, is there any other questions and comments? Councilman Derek Green?
Yeah, I'm just gonna make a very quick comment. I was going to add a little levity when Mr. Crawford talked about shoot your shot. That kind of gives the example of that cultural dynamic. But then started on a hip hop perspective. Mr. Crawford provided that, and Councilmember Johnson, Mr. Chair, you did the same. And it just brought another memory that even within our own community, that cultural difference can be very interesting, because I remember hearing the phrase sipping on syrup. I had to get that perspective from some of my relatives in the Texas area to understand that's talking about Robitussin as a way of using self-medication to deal with pain. And so there's a lot of dynamics to this issue. And Mr. Chair, as you were talking about these large entities and organizations, we spent a lot of time in City Council talking about the general fund part of the budget in reference to real estate taxes and wage taxes, business income receipt taxes, but that's only a little more than maybe 55% of the budget. 45% of the budget is coming from block grant dollars from the state to the city to go to Department of Behavioral Health, Intellectual Disability Services, to CBH and the Health Department. But because there's a grant dollars coming from the state, we often don't talk about that and have this conversation about how those organizations having provided contracts with culturally competent organizations who are doing the work in the community, and they may be giving them a small contract, but the larger dollars are coming to those large entities. So I just want to close with that and thank you for both of the panelists in providing testimony and the work that they do in our city.
Thank you very much. With that being said, we appreciate your testimony. And now we're going to go into public comment. If there are any questions and comments from members, I'm sorry, Councilman Isaiah Thomas.
Real quick, Councilmember Johnson, I didn't plan on commenting, but I do appreciate this panel specifically, but I also just wanted to make a note for the record, and I appreciate the work that they're doing, that this is going to be an item that we're going to have a very close eye on as it relates to this budget cycle. One of the things that I've been advocating for and talking about is that we ask a lot of the quote unquote grassroots organizations in the city of Philadelphia to beg for money out of small pots, like gun violence prevention dollars, or maybe through an OST grant or something like that, when we have hundreds of millions of dollars that we're spending on health and human services as well as public safety. So I just, I am concerned about grassroots organizations who's been grassroots for 10 years, right? Like, how long are they going to be? Like, at some point they have to graduate and mature out of the grassroots phase and into a more sustainable space. But then I'm also concerned about those sustainable organizations who deserve an opportunity to graduate into a more mature phase as it relates to the work that they do as a nonprofit. So I just wanted to put on the record that this is actually going to be one of our focuses as it relates to this budget season. And when we talked earlier during council about pushing even further, and I believe Councilmember Green kind of was the first person to spearhead that, this is an example of what we're talking about. So again, thank you to this panel, and thank you, Mr. Chair.
All right, thank you. Thank both of you for your testimony. There are no more questions. We will now go into public comment.
We have Abdul from the Coalition of Black Fathers.
Hello.
Hi, please state your name for the record and you may proceed with your testimony.
Yes, my name is Arnold Jones.
Mr. Jones, you can start your testimony.
Yes. Good afternoon. Ramadan Mubarak to all of my Muslim brothers and sisters. Peace and blessings to everybody. Thank you for allowing me to testify today. I want to start off by suggesting that we approach the issue of youth gun violence with some tangible results. So, or let's just get, as I would say, down to the brass tag. I am in support of organizations like NOMOPAC, if I'm saying it correct. They have the remedy, immediate response to child trauma is meeting their needs, hearing their voice, and serving them through social services with results, with resources. So if we look at what NOMOPAC is doing, they are taking our children from environments where they may be experiencing trauma, they may not have resources. They're giving them an environment where they're getting support emotionally, and they have that group dynamic, but they need resources from city government so that they can continue to expound on that type of support system. And I thought about this closely, thoroughly, my apologies, and I examined their organization closely because that's the type of work it's going to take in order to make an effective change. City government has to relinquish resources to these grassroots organizations that are in the trenches doing the work that, unfortunately, a lot of what we're seeing is a direct result of failure from government because the schools failed our children. There are social services from the government that didn't make it to our children. So we have to take that collaborative approach. And I know that as a young man walking the streets of South Philadelphia, I didn't have those type of services available to me. I walked right into Merrill Lynch at 18 and talked myself into a job. But there's so many of my friends and associates, they didn't have that. I listened to Councilman Johnson express his dilemma when he was in University of Penn, and he was still dealing with the personal challenge of his own identity. And that's why I respect when that kind of transparency is conveyed through the media so people can hear that we're all human and we struggle. So I appreciate once again you guys giving me the opportunity to speak in this hearing, but we want some tangible results. We need resources to help these children, and I'm available to assist at any time to lend my support. Thanks again. You guys have a great day.
Thank you very much, Abdul, and you keep up the good work. And any questions and comments from members of the committee? All right, Abdul, listen, I know you also have a program that deals with fathers and making sure fathers are in the household of their parents. Can you expound on that? Because that also plays a major role. The family household, the family dynamic plays a role in how young men shape their identity.
Yes. So Coalition of Black Fathers was a organization that I created as a direct result of my having been raising 5 children. So the dynamic of me raising a little brother, my dad died when my little brother was 3. That was in 96. So then I ended up with 2 stepsons. And then subsequently my boys came. But what I realized was I made a difference in their life in areas where I had struggled. So when my dad was disconnected from me, I went through the struggle. And I decided, let me just start doing this through the barbershop. And that's what I started doing. Now, building men up to realize that we will all encounter certain challenges, but together, coming together with support, giving each other that support system, relying on one another through your experiences, sharing those experiences and sharing resources, understand that we relevant and we make up a big difference in our kids' lives. So if I can be there for you, I will recognize your child in this community. And then I'll see if your child is involved in something, or I can take time to bring your child with me. Together we can have that village approach. But we're the front line of defense. So when you remove the father out of the dynamic, you do end up with the results of what we're seeing in the street today. So, I would like for you to understand, and I'll say that as a collective, to give support to organizations that actually directly impact these situations, because that's why we're not getting the results we need. And restorative justice has to play a part in this as well. We can't just keep locking everybody up. We have to find ways to work together so that the family dynamic can come together and be strong again.
Thank you very much. Any questions and comments from members of the committee? Okay, hearing none. Abdul, we thank you for your testimony. Thank you for taking time out of your schedule for speaking during public comment. Thank you very much.
Thank you very much. Peace and blessings.
If there are no other questions or comments from members of the committee, I want to take a moment and thank my colleague, Councilwoman Helen Gill, who's the chair of the Children and Youth Committee, for partnering with me on this very, very critical and important committee hearing. And so, Councilwoman Gill, do you want to add any final remarks before we wrap up?
No, first of all, thank you, Mr. Chair, for your leadership on this whole issue. And also, the importance of us having a laser-like focus right now on the need for trauma. Unless we center it, it's too easy to let this go. And I think one of the things that you highlighted in your opening comments, or as you were responding to Ms. Petrosky on the first panel, is what it feels like, how inhumane it is to have young people talk about violence and death in their lives as if it's, normalized. And, the long-term impact of that on young people is really, really serious for all of us. I mean, it holds young people, it can potentially hold young people back from their potential. And that is why we are doing this hearing, because we've got to center the voices of people who work directly with young people themselves, so that we can show the city there is a different way through it. You don't suck it up and bear it and move on with your life. We need to orient and reorient our city to get people supports and services, to recognize that there is an immediacy and a long-term, and that institutions have to do more. Our schools are anchors institutions for families that may lose a house in a pandemic or may be upended because a loved one is gone. So our institutions have got to do more. And I'm grateful to work with you, Councilmember Johnson. I think we're gonna come up with a really good roadmap on what this looks like, and it's going to be driven by the voices of people that you've always centered, which
Absolutely.
are the people who are directly impacted. So thank you.
Well, thank you very much. If there are no other questions and comments from members of the committee, this concludes the hearing on youth gun violence and trauma, the Special Committee on Gun Violence in partnership with the Children and Youth Committee. Thank you very much, everyone, for your time, and thank you very much for your participation. Take care.